Admiral Sestak, welcome back to Brian and the Judge.
I am so sorry I am late coming to you. Please accept my apology.
You got it.
Of the 1,000 guests that we've had, probably 800 have been late. No one has ever apologized except a 3-star admiral. I have the hair standing up on my arms.
I am just so.
Don't worry about it. We know you're going in many different directions. We want to talk to you about Arlen Specter and the Senate race in a minute. But first, was Secretary Sebelius floating a trial balloon on behalf of the administration when she suggested over the weekend that the federal option, making Medicare available to people below 65, is not an essential core of this proposal?
I disagree. I strongly disagree, and I really do call upon particularly the majority leader, Senator Reid, to start helping us lead in the Senate on this issue. There's too many misconceptions about the public health care option. I believe we must have health care coverage for everyone. That's good for Americans. But we must have health care reform because that's good for our economy and pocketbooks. And here in Pennsylvania, 70%, a new study came out, it's about 65% of all private health care plans are in two companies, two corporations. The public health care plan is merely to get fairer competition. There's no money subsidizing it from the U.S. government. It is only subsidized by the premiums and copays of those who join it, period. And it's a choice. And it begins to move us away from almost cartels because 94%, according to the Department of Justice, 94% of all insurance markets across America are in what they call highly concentrated markets, that is, close to monopolies. And that's why, if we just let things continue as they are, ours in Pennsylvania, we've in the last 8 years has a 90% increase in premiums. This is to get costs down, and that's why I strongly disagree with her.
So, Congressman Sestak, your research shows that if there is a government plan, it is not going to hurt the private insurance?
What it showed, no, it does not show that it's not going to hurt nor help. It does show that it is going to bring down premiums, because here's why. It's not subsidized by the government, but what you have is very little overhead, because you do know, as one CEO gets over $20 million for that CEO, and he got a $70 million severance pay. So what it does do is bring a much lower administrative overhead.
But you know you can't compete. Admiral, you know you can't compete with the government. If the government wants to win, it will unlevel the playing field. It will make it impossible to compete. For example, FedEx cannot charge 44 cents to deliver a piece of paper overnight. If it did, it would be prosecuted for unlawful competition against the post office. So it has to charge $10 instead of 44 cents. And if the president of IBM decides, well, why should we be paying premiums to our health insurance carrier for our 50,000 employees when they're paying for the federal option? We'll just stop paying the premiums, let them get this federal program. What happens to the insurance carrier that was receiving those premiums on those 50,000 employees? It goes out of business because its income is gone.
Again, I want to stress, no tax money is going into the public health care option. Excuse me, let me back away. There is one, they get a startup loan that is amortized and paid back over 10 years. But other than that, to get it started, no tax money goes towards the public health care plan option.
Well, where does the money come from?
The money comes, it's like a private health care plan. Where does the insurance company get its money? From the premiums and copays. And the public health care plan option does the same thing. Premiums and copays of those who decide to join up. And we passed that they have to negotiate with providers on the market. They can't. It's not going to be Medicare plus 5%. Was what the initial payments were going to be that they would reimburse. Nope, they've got to negotiate just like any private health care plan option. It really is a private health care plan. It really is. The only difference And I can show you the legislation. The only difference is, just like we pay the President of the United States about $250,000 to do his job, just like pay the Secretary of Defense about $200,000 to do his job, they're good public servants, we're going to hire somebody for about $200,000 to run it. Right. The CEO is not going to get $20 million. There's not going to be a big advertising cost to us. You get a choice if you want to come in, period. It's a private health care plan option that's called a public health care plan option because we're not going to pay for advertising. We're not going to pay for profit. We're not going to pay for overhead for.
So we're going to pay salaries for everybody that works there, though, right?
Yes.
Out of tax money.
Co-pays of those who join it, just like
right.
a private health care
just
plan
like motor
option.
vehicle and post office. Congressman, would you say this right now?
Such a misconception on
which
this.
is?
Say again.
How is that a misconception? The people that work there will get paid like federal employees.
No, they're going to be paid by the premiums and co-pays, just like the private health care plan option.
Well, how will the poor, Admiral, how will the uninsured, the 40 million uninsured who obviously want to spend their money elsewhere or don't have the money to spend, how do they get insurance if it's not going to come from the taxpayer?
The 47 million, let's just say 40 million plus million who are uninsured.
Right.
All right. 1/5 of them, as you know from studies, are those who earn $50,000 or $60,000 or more a year, are usually single, 30 years old. 1/5 of them, okay, and they just don't want to have health insurance because they're masters of the universe and will live forever. So they go to the emergency room, and when they're sick, and the hospital eats it, and it's passed as overhead. So the insurance company, you and I pay $400 right now today more for our insurance plan as individuals, $1,100 more for a family of four to cover them. Actually, that's what the insurance companies cover us because they eat the cost from the hospital who doesn't want to eat it. So they pass it to us, so the insurance company does. So here's what we do. We mandate they must be covered, including those who can't afford it, the uninsured, because they've been laid off, they can't afford COBRA. What we do is for them, they can pick whatever private health care plan they want in insurance market. They can go to Cigna. They can go to Blue Cross. They can go to anyone they want or the public health care plan option. We will cover them, those that are poor. We will cover them up to 400% of poverty level on a sliding scale. That is, if you're 200% of poverty level, you get a certain amount of subsidies. If you go up to 400%, you get a little bit less. And so they get to pick any plan they want.
Are you able to sell this at your town hall meetings?
Yes, when I've done 3 big town hall. I had the very first one in the United States. I didn't know it. I got out on a Friday afternoon at 4:00. The next morning, we had set up a town hall at 10 a.m. Only the local reporter was there, and man, it was a very exciting one. And I thought, well, that was exciting, and just kind of went about my business. I didn't know that we were the first to have this excitement. So, but in any case, when I walk through the logic of it, everybody doesn't agree. But in most of my town halls, what I do before I start, I go outside and I shake, like I had about 1,000 come to my second one, went and shook everybody's hand beforehand, came in, there were angry people. Oh, how could they not? How can you be trusting the government today? We've messed up so much the past 8 years or so. And so there's this anxiety. I don't think this is just right-wing people. Everybody has anxiety. And so I just factually go through. This is actually what the bill says. Look, I did read the bill. and so I walk them through it. And so what I say to people is, oh, the uninsured? Well, understand, you're paying for it already because they go to the emergency room. So what it says is if you do bring them in, yeah, we're going to pay for it, but that's where we got $550 million by certified savings, but the CBO has certified that they are true savings, and $500 million, yes, we had to get the tax, but we taxed those who were very fortunate over the last 8 years, those that are more well-to-do who got 53% of all tax cuts in the last 8 years. But they're covered, and the thing is eventually if they get preventive care, not when they're acutely ill, we pay less.
Well, a few things on this. Number one, right now with Medicare, how is that formula effective? How is your formula different from the Medicare formula?
Medicare does not get affected at all except on the positive side, the donut hole that seniors have to do. That is, Medicare D prescription drugs, what happens is after they pay the first $1,000 is paid by the government today, they have to pay the next $25,000 or $3,000 out of their own pocket. In fact, it's forbidden if they even have a private health care prescription drug plan to use that. They have to pay it themselves. We close that hole over 5 years. Number two, if you're a senior, and this is the same for you and me, for preventive care, you now have to pay zero copays, no matter which plan you go into, because we want people to get preventive care.
Got it.
Now,
Congressman, thanks for
joining us. Medicare Advantage.
Thanks for joining us.
I'm sorry to go on.
Quite all right. Thanks for joining us. We'll talk politics next time. We're right back on Brian and the Judge.